Not a problem at all. That's why I'm here. My name is Dr. Mkono, and I'm going to orient you on Wixela. Remember, this is a twice-a-day medication. It is a maintenance device. It's not rescue. It's not a quick reliever. It is not an add-on. This is your main squeeze, okay? Anyways, I want you to know that you would be holding it. Check this number out. Make sure yours is full, okay? Or has supply. It's gonna go to 0, there's nothing in there. Mine is 44, yours could be whatever number, but it's gotta be a number. Now we're gonna open, right? Look at that, see that? Still 44. It won't change until we close at the end. Make sure you rinse your mouth after. If I forget to tell you that, water, gargle, gurgle, and spit after every time you apply this particular inhaler. Now, the yellow comes down. Right there, now it is triggered. No shakes, no prime on this one. And you're gonna exhale as we always do for all our inhalers because we're gonna inhale the medication this way. So exhale first and make sure you do a good count to 10 and a good deep breath. All right? If you feel you didn't get enough, you can do another puff, but don't close, open, and then no. This is the one puff you can go back in again and again, but you're only gonna get one application, right? I hope that didn't confuse you. We are still at number 44. So now watch this. You will now close it, and guess what? It went to 43. So now 43 is for the next 12 hours apart, right? Maybe 10 to 12 hours at the end of the day, if this is the beginning of the day. And please make sure you now set this next to your toothbrush because you should be going there twice a day, right? It's the best place to remember. And you're going to gargle water and spit out. Remember, for this to work, that's your first dose. So guess what? It's gonna give you an effect, let's say 10%. The next dose, 20, 30, 40, 50, 60, 70, 80, 90, 100. At whatever day that is, it will be 100 going forward if you continue to take it twice a day. If you don't, it will be 10, and then 10 whenever you remember again, 48 hours later. It's not supposed to be used like that, just so you know, in case you were not maybe in any of my live sessions. By the way, YouTube guys, I'm on there. Follow me there, I will be on there. And make sure that you give me some sort of feedback. I like the questions and I like to answer back. So if you do not like yours to be used as the sample question, don't ask me. You just wait or ask your cousin to ask me a question if they're not as shy as you are. So I'm shy too and I'm learning. So here we are. We are done. Hopefully that helped. My troubleshooting tips for you would be maybe you're out of medications or maybe you have a bad device. Just remember, once you've seen your doctor for follow-up, they're going to check whether this dose at every day, twice a day, that's the problem. It's twice a day. They're checking whether it works for you twice a day. If you're doing it once a month and it's not working, they're going to start talking about injections and everything else to upgrade you. Make sure this is good first, okay? This one is 500. I don't know what your dose is, but there is room to go up to 500 on this one. Many inhalers are different, but many of them have a low dose and a high dose, and they have a combination. So there are things we can do before we get to injections. Be very careful that you're doing the right thing with your medications, and if you're not, be very honest with your doctors because we are treating you based on what you write down that you're taking. If you're not, just say, I have it. I just have it as decoration at home. Please to let you guys know that you do have to give me some feedback. But anyways, about the taste, I didn't taste much. It's just very fine powder. It's different than when I do the other inhalers. So you should taste a little bit of powder, but whether you taste it or not, if you have a device that is good, you should be rinsing your mouth after. Some people are sensitive to the taste, some people are not, but I did test very little. Compared to other inhalers, I usually taste way more, and it's more bittery in taste. This one was kind of fine and less obvious on the taste, okay? All right, so I think you got it. But you can always go back to the pharmacy in case it's a defective item, a device, and then also check your numbers, make sure they're counting down. And if it's 0, then maybe it's time for a refill. Take care. Bye.